Well, I'm Dr. Olaiwola Bello, the medical director of Subol Hospital. Well, I think the journey with Farm Access Foundation started about 2011 when there was a program called Ajia Community Healthcare Program.
Farm Access Foundation introduced a community-based health insurance scheme in Nigeria as a way to test the paradigm of how people purchase healthcare for themselves. And at the time, we started with the Lagos market women and the farming community in Shonga, Kwara State. Subol was selected as one of the providers on that scheme. And at the time, to be honest, one of our efforts was to make sure that the quality of service within each of the provider hospitals was improved. And so we introduced SafeCare to all the providers that were going to be providing care in that program. So that's how Subol was introduced to Farm Access.
So what they required of us were basic SafeCare standards that we needed to put in place, and we were able to put that in place within 6 months of our first encounter with Farm Access. If not for SafeCare, I'm very sure I wouldn't be where we are today. We won't be where we are today. It's been very interesting, and it actually opened also what quality is all about in medical practice.
So Farm Access Foundation, really, our focus is to improve access to quality healthcare services. And we found that over the years that it's not just about improving healthcare financing from the patient side, but it must at the same time simultaneously improve the quality of care from the side of the hospital. As Farm Access, we teamed up with JCI, which is Joint Commission International, the accrediting body for healthcare facilities based out of the United States, as well as COSASA, which is the counterpart in South Africa, to come up with a set of standards, especially for resource-restricted countries such as Nigeria, that allows hospitals to improve their quality without, spending way too much money, but just the basic quality improvement as a stepping stone to international accreditation. So basically, it's not a fail or pass process, but rather is a stepwise improvement to quality. At level 1, there are a set of standards that you need to implement for you to move on to level 2, and so on to level 3, all the way to level 5. So this is a process that we started over 10 years ago to move hospitals onto a better quality improvement and quality assurance program using our SafeCare methodology. So Subol again started its journey with us many years ago and started in at level 1 and has since been improving using the quality improvement plan, and right now is at level 4. So when you get to level 4, that means that the level of service that you're providing far outweighs quite a number of hospitals within your peers, and you're almost at the point where you can actually go for international accreditation. It's reflected in the quality of the staff you have, the adoption of clinical protocols and adherence to clinical protocols, the use of technology, the right number of medical staffing per patient within your facility, and quite a number of other initiatives.
SafeCare has about 13 elements, and all these elements are geared towards providing services that are safe for the people. It's all about safe care delivery. You have elements that have to do with governance. You need to put governance in place, clinical governance. You want to look at your laboratory. Is it well? Do you have facilities for outpatients to make it safe for them? Is your theater safe? Will it be safe for us to give you patients that we take to theater and the patient will come out? A whole lot of things. Basic things like, do you have, if a patient requires oxygen, is he going to get your oxygen? Do you have your ambulance? What is your referral system? If you have a patient that is for primary care and it requires secondary care, are you able to provide the secondary care? Of course, we can provide secondary care. If it requires tertiary care, can you provide it? We have to upgrade a lot of our facilities. For instance, the theater, lounge, all we needed to put in place. Most of these things we never have, but when SafeCare came into our practice, we realized that we really needed to scale up, and that was how we had to move. And each time we scale up, there's another level to go through, like starting from level 0, and within 2 years we are able to move up to level 4, which is just one more step to the very final step. And we are able to move progressively, and along the line you have to acquire equipment. They were even trying to give us, but of course, because the practice was actually attracting a lot of clientele for us in terms of patients who are coming, so we were able to really do something where we were able, in all honesty, to be able to raise sufficient funds without even recourse to to borrowing, taking loan from facilities, because the practice was really self-sustaining because people appreciated what we were doing, based on the fact that we have put a lot of structures in place that were very attractive to the patients, and so we are getting satisfactory patronage.
With Subol, you would find the management team, and Dr. Bello in particular, is very, very interested in quality. We just had another assessment last week, and each time we perform an assessment in this facility, you always see the genuine interest for quality. Dr. Bello always wants to know what next. I've never seen anybody more happier to receive a quality improvement plan, and even I as a quality manager, it beats me every time, because after an assessment, the next thing he doesn't ask for his report, he wants to know, so when am I getting my quality improvement plan? So with Subol, it's interesting because who doesn't like to work with a facility that wants to work really? And that's Subol for you. Every time they want to know where they are at, where the weaknesses are. Don't praise me. That's Dr. Bello's stance. Don't praise me. Tell me where I am lacking so I can improve. He would rather you tell him where he's lacking than tell him where he's doing well. So with Subol, it's sort of easy, for lack of a better word, because you can tell that they're ready to work and they want to improve on services.
So Subol Hospital has really been a trailblazer, if I can call them that. Dr. Bello has really embraced the quality improvement path. And since he started implementing SafeCare, I mean, he has been the place to go for best practice for other hospitals to understand what is going on and how quality improvement is being implemented. He has seen footfalls within his facility increase. Much of the community around where his facility is in Alomashore local government area has, taken Subol Hospital as the place to go to receive care. In fact, because of the increased utilization, the increased quality in improvement, Subol has actually been able to expand its services and has been visited by so many dignitaries who want to see quality improvement in action using SafeCare methodology, including Her Royal Highness, the Queen of the Netherlands, Queen Maxima, the Director Peter Sands from Global Fund, among so many other visitors to Subol to see how they are improving quality of care.
My admonition to colleagues is that this is the way to go. It's just SafeCare standard. Quality care is always associated with it, so they must engage them. And that's my advice. Any forum I meet people and say, look, this is something that's been very helpful. Nothing special that we are doing except for the fact that we have bought into the SafeCare standard, and if you go into it, the result will be very, very rewarding.
With Subol, the immediate goal is to move them from a level 4 to a level 5, because they've been on a level 4 for the longest time. So hopefully we can move them to a level 5 this time. And after that, introduce the SafeCare accreditation product so that the whole world, not just Lagos, can see how good they are and how willing they are as a facility to give out the best that they can.
I think with Subol, it goes to show that, when you adopt a quality improvement program or you're within a quality improvement program, that you have a system that allows for quality improvement across board, not just from the skills of your personnel, but from the equipment and the infrastructure within your healthcare facility. So that it's really important that most hospitals, if not all, including the government-owned hospitals, enter into a quality improvement program such as SafeCare. Measuring quality using SafeCare methodology provides a really important pathway to make sure that services are continuously improved, and quality of the health outcomes is also measured so that there's a benchmark and identifying areas of improvements needed.
So for facilities who haven't joined SafeCare, my question today will be, what are you waiting for? Everybody is waking up to the quality wagon, and it's about time you joined it. Everybody wants to go to a facility where they feel safe. Everybody wants to go to a facility where they're sure they'll come out better than they went in. Everybody wants to be respected, and everybody wants their privacy upheld. And that's what SafeCare affords as a quality improvement methodology. And apart from some of the things I've mentioned, it also helps you as a facility cut down on wastage, because we help you look at your processes and help you become better, but just helping you quality assure your process so that from the point where a patient walks in to the point where a patient walks out, they can come out saying, oh, this is a good facility. And they can also tell their brothers, their friends, their neighbors, anybody about that facility. So for us, is that every facility offers quality service so that the populace, everyone in Nigeria, can feel comfortable knowing that when they go to a hospital, they're going to come out better than they went in.
The best thing that happened to my practice in the close to over 25 years I've been in practice is having to associate with Pharmacists Foundation, and Pharmacists Foundation taking me to SafeCare standard.